pleasure to be back at Exponential Medicine amongst friends. Show of hands, how many of you have attended a blockchain talk in the last 90 days? Keep your hands up if you left that talk more confused than when you entered. You're not alone. Blockchain occupies this special place that the MIT Tech Review calls the intersection between hope and hype. And for the next 7 minutes or so, I'd like for us to stay in that intersection and talk a little bit about the potential of blockchain in healthcare, the good, the bad, and the ugly, from the perspective not of a technologist or a healthcare executive, but from the perspective of a patient. This is the perspective that I brought here last year at Exponential Medicine when I introduced you to somebody very special to me, Bertha, my giant angiomyolipoma, or kidney tumor the size of a football. Typically, these tumors are benign, fairly frequent actually, not atypical. Anything over 3 centimeters is highly risky and recommended to be removed. At 36 centimeters by 16 by 18, Bertha, as I so fondly called her, was quite improbable and frankly resembled more of a verdict than a diagnosis. Yes, you could be surprised, you could be amazed, you could be impressed if you're a physician in the audience. I certainly was surprised when I first discovered her at a routine physician visit. And so what happened to me, because of that verdict, and armed with my curiosity and problem solving and frankly sheer grit and stubbornness, I decided that I didn't like the odds. I didn't like the odds of either losing my kidney or worse. And so I started asking questions. I frankly started emailing my CT scans and calling people, and Daniel was one of those calls. And I started asking, what if? What if we were to put physicians who are looking at kidneys as well as physicians who are looking at this from an oncology perspective and combine these physicians with experts from other fields like 3D printing, computational science, 3D modeling? What are the odds of us being able to remove her, Bertha, without losing my kidney? For me, that started a process of 18 months of fairly rigorous journey of 36 different visits with at least 6 diagnoses that I had to rule out, with a couple of interventions that we decided not to do, with finally resulted in 1 embolization, 1 partial nephrectomy, meaning removing part of my kidney together with the tumor, and 2 readmissions because of the complications that we couldn't see happen. My journey of 18 months and all that data successfully led me to also Bertha's farewell party. I share that story because it has shaped me as a leader, but it, for me, also is the backbone of why I believe blockchain is so promising to do things in healthcare. And the reason blockchain offers so much potential is not because of the way the technology is set up and how we can operationalize it. It's so powerful because it allows us to deal with the issues that I was facing that were actually covering up much deeper, fundamental, systemic issues that are pervasive in healthcare. And so when you think about blockchain, the real question is, what could blockchain do for me? As a patient, what could blockchain do for me as an executive in a hospital or in a health plan, or somebody who's trying to make decisions for their loved ones? There are 3 reasons why blockchain is so interesting and powerful. 1, it's trusted. What that means is that we've used decades of cryptographic or cryptography research to create what we call a computational trust. What that means is the data, my data that's stored on the blockchain, cannot be accessed or edited without my permission. It also means that I get to be verified uniquely and reliably. No tampering, no backdoor access. You could see how that becomes very interesting for solving problems where huge amounts of information, sensitive information, needs to be shared across parties that are not necessarily inclined to have trust in each other. For me, that would have been very nice if I didn't have to text my CT scans or FedEx the CDs to the Del Coronado desk here, but if I had a single sign-on that I could acknowledge which one of my providers or partners in my care team gets access to my data. Secondly, blockchain allows us to never wonder who has the most up-to-date version of the Excel sheet. Because of the consensus mechanism, there's no reason or no question around where the data is stored and what's the most up-to-date record of that data. That becomes very powerful when we're dealing with large data sets of fragmented data with multiple owners who are actually tasked with updating or maintaining those databases. For me, what it would have been really helpful is to have a reliable way to pull up the providers who are experts in the specific field of tumors or kidneys, as well as experts in functional medicine and other domains that could be reliably credentialed for those purposes. And finally, when we think about blockchain, blockchain allows us to share data without the need of a third-party intermediary. This becomes exceptionally powerful when we need to stitch together data from different sources and have a longitudinal view of the transactions, interactions, different interventions. And when you put those three characteristics together, what blockchain allows us to do is solve systemic issues that we call utility problems, problems that are so big, so painful for so many parties in the ecosystem that collaborating to solve them is worth the transaction cost. With that mindset around big, audacious problems, we set out to solve questions like patient identity management, patient consent. Studies show that 35% of the denied claims are due to missing patient information or misidentified patients. Medical errors are due to patient misidentification. Other problems that are worthy of the blockchain-enabled solutions are problems like how do we keep the provider databases up to date? How do we know that the providers that we are working with are credentialed to work in that specialty in that state? These are all big, audacious, systemic problems that would have made my life and my experience with dealing with Bertha much easier, but at the same time touch every single angle and aspect of healthcare as we know it today. So my journey of 18 months could have been shrunk to a much more enjoyable, possibly 8 weeks, of which 8 days would have been spent on actually problem solving and 7 weeks wrapping my head around what was going on around me, into a faster path. This is the promise. And as I said, in some of those meetings that you've probably attended in the last 19 days, you've heard the hype, you've heard the fear, the unknown. We're seeing that Wall Street Journal showed up that about 16% of all initial coin offerings have a fraud detected in them. And when you dig deeper and ask what the fraud specifically entailed, 2 main reasons. 1, identity theft. 2, improbable promises and results. Things like 0 risk and guaranteed profit. If I ask you what are the 2 most common reasons for fraud in traditional public offerings, identity theft and improbable promises. The point I'm making is very simple. Blockchain as technology has far less unknowns and reasons to be fearful than our ability to use it and put it to good work. And we'll get more into that later. Finally, in order for us to realize that blockchain promise to its full potential, we need to really think about not necessarily about the tech, not even the data flow. The more important question for us to solve is the workflow and actually the money flow that's required to change hands for the blockchain solutions to be adopted at scale. it is with this mindset that a year ago, we started a consortium, a group of different perspectives in the healthcare system coming together to solve for the non-tech-related problems that are associated with adopting blockchain at scale. We founded the Health Utility Network between a group of plans, providers, financial services, and tech companies to help us solve questions like, could we all agree to build blockchain solution on shared platform with shared standards and requirements? Could we all use our collective scale to ensure that those blockchain solutions we build would have the adoption and will mandate the workflow changes and the cash flow business model changes that are required for those blockchain solutions to stick and scale? Between the members of the HUN network we cover 1/3 of the US population. We are advanced in digging deeper into the questions we need to solve for, not necessarily to build solutions on with that common standard in mind, but also to create the right awareness and movement for the incentives we need to restructure and the changes we need to make in our workflow and administrative flows. What I wanted to show to you is how this might look like, what this might look like. If we take a neighborhood of organizations who know each other and traditionally exchange data with each other, those red pipes you see is the traditional current flow of data that has its limitations. The blockchain solution, once adopted and from the HUN members, would allow them not only to take that solution on, but also start to solve for those workflow and cash flow incentive models together and jointly. That allows us to start adding additional pieces to that network, pipes and flow, that allows us to then add more scale to the solutions. With that in mind, I wanted to put that conversation to the test and allow you to hear it from some of the partners in crime from our HUN collaboration. And I wanted to invite Ted Tanner, Sonja O'Malley, and Addison McGuffin to join me on stage. Okay, so we'll start easy. Given the hip-hop conversation we had, first of all, centralized or decentralized?
Right.
All right, there you go. Well, let's start the easy part. So you're representing a plan. We have a provider perspective. We have a tech perspective. What part of what I just described makes you most nervous?
So again, we're in this world that we're learning about every day more and more. So blockchain has evolved. It's been introduced. We've seen it operate in the financial space, supply chain, a variety of other domains. And so now we're applying these learnings to really kind of support a model that's been around for, I don't know, multiple decades, older than I am even though I'm pretty old. To that point, it's one of these things where changing the model in which organizations who have grown up in silos now have to kind of interoperate and trust. Mm-hmm. So this perceived interdependence that basically this mode of business operation introduces is the transformative moment. It's like, can we figure out the technology? Absolutely. There's a lot of great minds that are working on this. Even through the course of today, we saw a lot of examples of technology that's going to transform and be a part of this. It's really the business constructs. It's the consensus models. It's the incentive models. It's the things that have really kind of been the foundation for the businesses that this will now become a part of. That is the hard part. So that's really one of the pieces that we've chosen to kind of focus in on. There's been some use cases out there that have demonstrated, hey, the core capabilities are possible. Those use cases are pretty consistent across, for instance, all of, between payers. I mean, there's not a lot of difference between, how we, look at coordination of benefits, mm-hmm. or we, look at things like pre-authorization, or we look at even down to claims, even though we may handle them slightly different. The logic that sits behind there today is pretty similar. And actually, when we got into this hunt, that was I would call it we knew this, but it was kind of the vulnerable moment, I guess you would call it, to acknowledge the fact that, hey, we do billions of these same transactions in our own shop every day together. Why don't we try to figure out how to really kind of improve that?
Yeah.
So again, from a payer perspective, we're always going to go back to things like, understanding, cost, access, and quality, because that's our commitment to, again, the people that we serve.
So on that cost, access, and quality point, Sonja, give me one thing that from the provider perspective you think is the most difficult when it comes to, or needs to change when it comes to adopting blockchain solutions.
Yeah, well, I think, it's important that we put the patient at the center of this process, because it is our mission to best serve that patient population and take care of them through their lifetime and that longitude of care. And so we want to keep our consumers and patients healthy. We want to, through that transition population, the worried well, be able to treat them at that point, and then when they come in and out of sickness. So if we keep with your theme, Addison, around prior authorization, for example, at the end of the day, if we can reduce that friction so that we can get a patient in, for example, for chemo within hours or days instead of days and weeks, which is where we're at right now, that's the most important thing to deliver that personalized care for that patient. They don't care how the sausage is made behind the scenes and how many times we fax back and forth. What's most important to that patient and their family is how do we get them in to treatment soon to be able to take care of them.
And prior auth is a great example.
Yeah.
Ted, give me your 2 cents on that. And you're the unexpected wild card in the mix. Could have done multiple things after being a successful entrepreneur. Why on earth do you have to join the hunt and be part of this adventure?
Well, as the global CTO and chief architect of Watson Health, I believe that the future is open source, distributed AI everywhere. And as such, the amalgamation of technologies of blockchain, this is probably the second time in history since the web started that we have this amalgamation of technologies. The most important aspect is what Addison mentioned and Sonja mentioned, being frictionless, connecting the provider to the consumer, to the patient, and getting the technology invisible and out of the way. And I personally think that from a technologist perspective, it is one of the greatest things that we can do is get out of the way.
That's right. So how are we going to get out of the way so that the clinical workflows are being adapted and changed? So some of these blockchain seamless solutions could actually take hold. Sonja, what's your point of view on that?
Yeah, I think like anything, trying something that's a little newer, I think incremental steps with some success and being able to iterate is really important. So if we think about some of the communication and messaging that needs to happen along with selling that message and that story, it's demonstrating those early successes. So if you take a look at examples, maybe we start with something like a provider credentialing, which doesn't go at the jugular of PHI and some of those concerns around being good stewards of the data and who we're sharing it with and how much we're sharing at the appropriate time and changing that dynamic. And then maybe progressing into some of those more sophisticated use cases that include PHI, like the prior authorizations and exchange of medical information for other purposes and clinical trials and things of that nature. I think one of the things that's really important around that messaging is being able to demonstrate those successes and be able to predict those implications to the workflow, like you mentioned. So for example, these resources will be needed to manage this process, but they may not be doing the same things that they do today because the dynamic is different, the time frames are different. So being able to estimate those impacts and plan for that ahead of time will, again, for the success and be able to iterate, because resources aren't going away, they will just be leveraged in a different way to impact the care of our patients.
In one word, what is the one thing that we could all do differently to accelerate that process, right? Coming together in the hunt and working together has not been an easy task. I think that's a fair statement to make. And so what could we all be doing differently to accelerate that? I figured you might have an idea on that.
Transparency.
Yeah.
The incentives of trust and building a global borderless trust protocol comes first with transparency and incentives, so being transparent.
There you go.
Add to that, I would say tenacity. I think that, this isn't easy. Specifically when we get into these computational governance models and, we get into now scale of this now interoperating kind of across all of our business plexes. I think that, all education, creating confidence specifically with our, respective organizations that, this will work, and also helping them redefine value. Because I think that's also very important too, because value has been really kind of experienced through the processes that we have today. And the question is, once that friction is lowered and things can happen in a second that used to take weeks, in a very reliable, trusted, and immutable way, then what do you do next?
That's great. So, Sonja, your one word.
Consensus. And
the easiest of all. Yeah. Well, thank you so much for joining me on stage. I think this was very insightful. Make sure that you find us after the session and follow up with the tough questions. Thank you, guys.
Thank you.
Thank you.
Thank you.
So continuing in that intersection between hope and hype, in that intersection between misaligned incentives, changes that need to happen to our business models, you heard from the patient side, you're hearing from the construct of a consortia that is one of many. And with that in mind, I wanted to also close that conversation with the perspective of a third-party ecosystem view. And I would like to invite Heather Flanagan, who's part of Consensys, who's going to talk to us about what this all means from the perspective of the ecosystem. Take it away, Heather.
Thank you so much. Hello, everyone. What a difficult act to follow. So one of the things you must have observed in all the discourse that just happened here is that technology problems are actually only a small fraction of what we're dealing with. Sure, there's scalability, there's novel cryptography, but the advancement of that technology is happening so very quickly, so much more quickly than we have the ability to transform at that kind of pace. It requires a different kind of convening and a different level of collaboration that we have had in our industry to date. Instead of individual institutions running their own infrastructures, functioning as economically independent actors, this new technology and its convergence with things like machine learning, very advanced new cryptographic methods that change the paradigm of what we think of as private, what we think of as identified and de-identified data. We need a model to come together to be able to transform in a network of network model. There are standards development organizations. I'm proud to be a part of one called IEEE. I chair the standards development activity focused on the use of blockchain in healthcare and the life sciences globally. IEEE advances technology for humanity. You can credit it with the first power grids all the way up to the Wi-Fi that you're using right now. And we have an opportunity in an open standards development activity to work on some of the most technically challenging and the most structurally complex opportunities for improvement before us. A key thing about an open standard is that it requires engagement. It requires participation. All of you are not only welcome, but strongly encouraged to join and participate in the creation of those standards. But blockchain and those technology standards is just one layer. This is a really interesting technology because it's more than a technology. It's the first opportunity we've ever had in human history to have a technology that allows us to run an experiment around incentives particularly. Blockchain gives us an opportunity to conceptualize, design, and execute experiments using game theory and behavioral economics. And if you buy this hypothesis that our biggest barriers to transformation using this blockchain and converging innovations are not actually technical, but all of the systemic issues of having diametrically opposing incentives among so many different stakeholder groups, we decided to focus there with all of you. Instead of thinking about engineering details or trying to convey that you now need to become an expert on cryptography or know about all these different blockchain platforms, the real issue, the heart of the matter, is how in fact can we restructure those incentives now that we have an infrastructure that makes that possible. So tomorrow we are having a breakout session. And I hope it's historic. I hope it's epic. I am so optimistic that a great big bunch of you might be willing to come and participate. And the exercise that we're doing is around incentive design. So it's blockchain and incentive design, and you will not be required to know a single thing about the technology. The point will be what kind of negotiation between stakeholders with opposing interests can result in something that can be abstracted away from the basis of competition, made pre-competitive. How do we have that rising tides lifts all boats in a way where we create as many winners as possible and we move away from win-lose dynamic thinking? So tomorrow there will be groups focusing on that negotiation, on the mindset of finding that win-win. And then we will have a follow-up community leading out of that where the ideas that originate in this conference can actually be carried through. And it will be integrated with ecosystem participants from IEEE. I also co-chair the HIMSS blockchain task force that is very active. There's so many opportunities to engage. So with that, I ask you, please do come and participate and see how, if you throw your hat in the ring, how does the negotiation work out? And then what can we carry forward together coming out of this event? I look forward to meeting as many of you as possible tomorrow, and thank you very much.